of having their social and physical health and mental health needs unmet. In addition to mental health concerns, clients are often struggling with other challenges such as poverty, unemployment, housing instability, homelessness, family challenges, violence, or addictions. So we're often working with our clients around a range of issues that certainly impact their mental health recovery. Next slide. So for a very small organization, we actually provide a large number of services and programs and work collaboratively with community partners to offer more comprehensive wraparound supports where possible. So this slide here lists our core services, but this past year alone, like I said, with approximately 24 full-time and part-time frontline staff, Lanark County Mental Health offered 43 different programs, including groups, and supported over 4,200 individuals and their family members. In addition to the services listed here, we also offer centralized intake for and host specialized services, including the geriatric psychiatry outreach program through the Royal, and the dual diagnosis assertive community treatment team, early intervention in psychosis, which is Heads Up and On Track. And in order to have the greatest reach across the county and to ensure that our services are as accessible as possible, we're operating out of a number of different locations. So we currently have our main office in Smiths Falls. We have an office in Carleton Place. This fall, we'll be opening a third office location in Perth, which we're really excited about. And our staff are also located at the 4 hospital sites, so 3 hospitals, 4 hospital sites across the county, and at the Smiths Falls Police Services Office and the Lanark County OPP detachments. And in addition to that, our community treatment team of nurses and case managers also work across the county, delivering services in people's homes and in the community. Next slide. Next slide would be great. Thank you. So I figured this might be a program that you're more familiar with. You may have heard a little bit about this, as I know Chief McGilvery has perhaps spoken to council about this. The Mobile Crisis Response Program. It's actually a great example of a program that is made possible through collaboration with community partners, and in this case, our partnership with Smiths Falls Police Service and Lanark OPP. This partnership began in 2018 when the OPP received funding, and the Smiths Falls Police also received funding. It was one-time funding, and we piloted the first mobile crisis response team in our region. The model at the time involved leveraging existing resources and co-locating part-time mental health nurses at each police partner site so that a trained mental health professional could respond together with police and provide comprehensive crisis supports at the scene of an incident. So we had some really great early outcomes for the program, which helped us demonstrate the success. And in 2019, as this one-time funding came to an end to OPP and Smiths Falls Police, we received confirmation of funding from the Champlain LHINs. So we weren't eligible for that funding, but through our partners at ConnectWell Community Health Services, they allowed us access, or they provided us funding to operate the program. Next slide, please. Thank you. Okay, so here I've just, I'm highlighting some of the new programs we developed over the past year to respond to increasing and different needs that we've seen with the onset of the pandemic. We were successful in securing one-time emergency COVID funding from Lanark County, the LHINs, and United Way. And so some of the programs made possible with that funding were the COVID Isolation Center, which we set up in partnership with Lanark County Interval House, a toll-free pandemic mental health line indicated here, where we expanded our hours into the evening. And we also expanded a walk-in counseling clinic, a same-day service that saw an immediate uptake in services and has been instrumental in ensuring that brief services are available and accessible to any resident who is 16 plus with no referral needed, no diagnosis needed, accessible to anyone in the community. Unfortunately, with the exception of additional funds that was provided by the county to support the ongoing operation of the isolation center, almost all of our one-time funds have been exhausted, and there are no additional funds beyond our usual budget that have been secured. And not having any increase in our budget or funds to continue these services is particularly concerning in light of the fact that COVID-19 is having profound effects and certainly has led to a surge in referrals. So I'm just gonna, so slide 6, the next slide would be great. Thank you. So here's a quick snapshot of how we are doing in Ontario and Canada more generally. So 44% of Ontarians self-reported that their mental health had deteriorated. It's hard for me to read because all of our pictures are in the way. Has deteriorated since the onset of the pandemic, and this is actually a rather low number because when I looked at a number of other studies, we actually saw that some reported around 40%, others up to 77% identified that adults may be experiencing increased mental health concerns or worsening mental health as a result of the pandemic. The COVID pandemic has had a startling impact on rates of suicide. Suicidal thoughts in the general population elevated to 8 to 10%, which is substantially higher than 2.5 pre-pandemic. Also alarmingly, domestic violence rates and people using substances like drugs and alcohol to cope with the pandemic have also been much pronounced. People struggling with mental health concerns before the pandemic were more likely to report that their mental health, sorry, I'm gonna have to move this. People struggling with mental health concerns before the pandemic, so people who had mental health diagnoses before the pandemic were 2 times more likely to report that their mental health declined and 4 times more likely to have had suicidal thoughts or tried to harm themselves. So overall, while there's a large number of Canadians that reported a decline in their mental health, the decline is more pronounced in people that are more vulnerable as a result of social and economic inequality. So those who are unemployed, do not have access to safe or affordable housing, people with disabilities, or those that identify as LGBTQ2+, for example, have certainly experienced, have been hit harder by the pandemic. These high numbers probably come as no surprise to you. I think all of us have been experiencing numerous losses, fears, and anxieties related to our own health, the health of our loved ones. And we also know that social connection and positive relationships, our usual protective factors that help us do better and be well, have not been accessible for many people. So the other thing too that's probably important is that we've learned from previous previous exposure to community disasters where there has been an experience of some kind of prolonged adversity or a prolonged activation of the stress response system, that we will often see increased mental health problems, including things like depression, post-traumatic stress, problematic substance use can persist for long periods of time after a large-scale community disaster. Okay. And so for this reason, we really do need to increase our capacity to provide services in the community. And we really do need to ensure that timely access to mental health counseling and supports is available to everyone in order to mitigate or prevent a post-COVID mental health crisis or epidemic. I think I've heard the words echo pandemic more recently. Next slide. Thank you. So we've seen a rather large surge in referrals. The volume of people seeking mental health supports from Lanark County Mental Health and from other mental health services providers in general has increased substantially since the early months of the pandemic. And we also understand that the needs will emerge and requests for services will likely continue to increase in the aftermath of COVID-19. So unfortunately, as a result of long-standing underfunding in the mental health sector, especially in Lanark County, where funding inequity is stark, our ability to appropriately respond is limited and will remain limited without any substantial increase to funding. As you can see by the graph here, we received approximately half the number of referrals at the start of the pandemic in Q1, which is April, May, and June, as we received in Q4, January, February, and March, where we received 1,127 new referrals over the 3-month period. Next slide. Thank you. So at the start of the pandemic in Q1, our referrals had actually slowed from the previous year. But by Q2, our numbers had grown above the previous year. And by Q4, we were receiving on average about 17 new referrals per day and 30% more referrals than the same time the previous year. Next slide, please. So I just have this slide here to indicate how much we saw an increase in the mobile crisis response team. So we saw an increase of 47% from the prior year. We have seen this increase. We saw an increase the year prior as well, as our program has expanded. However, in this case and in this scenario, we know a lot of it is related to the increase in crises we're seeing in the community related to mental health. And next slide. So Lanark County Mental Health does not currently have adequate resources to attend to the surge in requests, especially given the increasingly complex needs we are seeing. For a small organization with approximately, like I said, 24 full-time and part-time clinical staff, we received over 3,600 new referrals for service this past year alone. And I guess our biggest concern right now is that Lanark County Mental Health is not sufficiently funded to meet the needs. We're funded at a significantly lower level when compared to other mental health agencies across the Eastern region and beyond for the services we provide. In December of 2019, so prior to that pandemic, when I first arrived in the county and couldn't seem to find other service providers that were providing the same services or similar services, and kept coming up against some walls, we started to do some research, and we did a review of the Southeast LHIN's CAPS and community mental health funding across the Southeast region, and discovered that Lanark County Mental Health received only a fraction of the funding of other agencies and substantially lower funding per capita for the region that we're supporting. Next slide. Thank you. So, some of this inequity may in large part be due to the fragmentation of Lanark County between the legacy Southeast LHIN and the Champlain LHIN, as well as competing visions about how to best organize community-based mental health services. The LHINs have now been integrated into a central point of accountability with Ontario Health, and so we're planning to identify the funding inequities and to identify the consequences this has had for our communities and to advocate for the required funding adjustment. Next slide. Okay, so so many mental health care needs that existed before COVID-19 remain unmet due to chronic underfunding. Our mental health system before was struggling to meet the needs of people with mental illness. There have been lengthy wait times, insufficient access to treatment well in advance of the pandemic. The pandemic didn't create the current situation, but it has certainly worsened the situation and has amplified existing issues. So Lanark County in particular, and the lack of funding, indeed stark funding inequity, is particularly concerning as we seek to support the community at this time. For Lanark County Mental Health, This means that in addition to focusing our efforts in service provision, we also must advocate for the resources that are necessary to ensure that equitable access to mental health care is available. And in so doing, we want to draw the attention of our stakeholders, of our funders, to how unmet social determinants of health, like food security and safe and affordable housing, intersect with mental wellness and inform recovery. Recently, recently the county has submitted an AMO delegation request to the Ministry of Health to express concerns related to the surge in requests for service and to seek sufficient and equitable funding, including additional funds to attract and retain psychiatry in the county, which has been rather challenging as well. So Lanark County Mental Health is asking for the support of Smiths Falls Town Council as we inform, advocate with funders and stakeholders about the need for increased resources and equitable funding for the region. Thank you.
Yeah, my colleagues may have questions and comments now. Anyone have a comment or question? Mayor Panko?
Yeah, thanks, Rebecca. And I'm not sure where to start because, I mean, you've delivered what is a really disturbing message. I mean, the chronic underfunding pre-pandemic has impacted your ability to provide service to the people who need it the most. And I know in Smiths Falls, there are probably hundreds, if not thousands of people that require support. And as you mentioned, the pandemic just simply made it worse. And when I saw the numbers, when it comes to the funding allocations, I mean, I would consider Lanark County to be fairly similar to Leeds Grenville, yet we're getting 15% of the funding that Leeds Grenville gets. Go ahead, yeah, please.
Sorry. I just wanted to mention that some of the Leeds and Grenville funding does cover some services that are provided in Lanark County as well. So that is something to keep in mind, certainly not in the amount that we require or that would be considered equitable.
Thank you. And so that impact on an individual's, as you mentioned, social, physical, and mental health, because it's all tied together. Their ability to fully participate and as a member of the community, their ability to work, their ability to enjoy, get a quality of life is all inhibited by really a lack of resources, which is driven primarily by a lack of funding. So I would say it's sorry, but it's like getting kicked in the stomach a little bit because we know other people in our community who need support and aren't getting that support. And despite what's probably an incredible effort by yourself and your limited team. So in my mind, absolutely, we will support you any way we possibly can. And if it means participating in the delegation with Lanark County or seeking our own delegation, I think it's obvious we would do that. And so from a question standpoint, I guess, understanding the pandemic changed how you had to operate and the challenges this brings and the barriers that come up as a result of that. And understanding that, as you mentioned, many of the clients you're trying to serve have already been impacted economically and socially, or many are living in very modest incomes, may not have access to a tablet or a computer or maybe even a phone, maybe pay as you go when it comes to their phones or internet services. So how, and the cost of having to maintain those things when you're living on a very limited income. So how have you been able to adjust to try to continue to provide service to people who really need it?
So our emergent services or crisis services have been operational face-to-face for a number of months now. I think we sent staff home for the first few months and then realized we can't continue that way. So a lot of our urgent and emergent services we continue to offer in person. We developed a triage system. So there are clients that we are seeing in person, but we also, we're so fortunate to receive some telephones and some funding from United Way. And we were able to get some technology out to our clients. Some of the phones that we got, we worked with the county actually to get to people who are homeless, and others we used to help people access appointments. We also set up a Zoom room on site at the office in Smiths Falls and created the same capacity in Carleton Place. It wasn't enough. It's not enough. People with significant and persistent mental illness, many don't do well with virtual services. And we do have to be cautious, because I think a lot of people are talking about virtual services and how great this is. And a lot of sort of low to moderate folks experiencing depression can work well online, and there's certain types of services that work well online. And then when it comes to some of our client population, we really need to be doing work in person. And I think we have some catch up to do. So not only do we have a surge in requests, we have some catch up to do because of the folks we weren't seeing directly in person that hopefully will be slowly beginning to do more and more in-person work. Our case managers, for example, couldn't really do much on the phone. They're back out in community and have been for a really long time.
Well, as you mentioned, you're the same budget. The one-time funding is gone, and yet you're dealing with an incredible increase in the number of people seeking resources. And again, you expect the number to rise. So, I mean, thank you for all you do. And if there's whatever we can do to help, in my mind, we need to be there with you.
Thank you. Councillor McGuire.
Thanks, Madam Chair. Thanks a lot for coming tonight, Rebecca. It's something where I remember knocking on doors that came up a lot, and I don't think I really understood the inequity until you put it up in the slide and laid it out like that. If you're living in Lanark County, you're competing with roughly the same population for 85% less funding. And it's mind-boggling. And I don't understand, even with the explanation, how we got to this point or how we get out of it. But I really hope that you get the opportunity to keep visiting council meetings and getting the message out there. I used to think that looking at the mental health crisis response with the police service, this is a great success story. You know, these are calls that were probably going to be directed towards other areas. And now a mental health professional is coming with the police officer, and that's an improvement for sure. But seeing the surge in demand and the stagnating funding, now the way I look at this is that as a society, and this is municipal to federal and everywhere in between, we're putting people into a state of crisis, and the only time we're willing to send help is when it's reached that point of calling 911. And I think, what does that say about, you know, not just our community, but our society as a whole, that I don't, as much as this is a success story and it's an improvement, it's not a time to pat ourselves on the back and say mission accomplished. I'm interested in the city of Toronto. They've been doing they've been diverting the nonviolent calls away from the police service and having a civilian response for mental health crises. Is that something that we're looking towards in the Lanark County program, or is that something that you think could work in the rural context?
Thank you, Councillor McGuire, for your question. I just think that they're piloting something in Toronto, and I have heard rumblings about it. I think what they're doing, though, is it's at the police services when the calls are coming in, and they're police service staff. So I think the OPP have mentioned that may be something that's coming their way as well. I'm not sure if Smiths Falls Police is going to look at that. I think they're piloting something to see what kind of outcomes. I think it's having good. I think they've had good results already, from what I know. I don't know too much about it, but I think it would probably be something that I think we're doing it in small ways now, actually. When the police are getting calls, or when calls are coming in that they don't have to respond to, our mental health nurse may be able to go out, or a mental health social worker may be able to go out, but we have not yet adopted it. It's probably a good something that hopefully will come into our way as well. I would suggest that you're right. It is a great program, and I don't know what we would have done actually through the pandemic without it. So if ever there was a program, imagine so many people are holding back and not providing service in community, not seeing people face to face. But our mobile crisis team, for the most part, after the first month or two, was back right out there providing services in community with, as soon as we had PPE, they were out there, and I don't know what we would have done without them. The problem is when they require more ongoing support, the supports are not there. It's hard for me to say this because we are supposed to be this support and we're doing so much, but but it's we're just not funded at a level that is sustainable or really able to respond to the community's needs. So we have to follow up with that, even to have a better impact and have those people not calling 911 again. They need services.
Thanks. And second question is, do you feel like the stigma against mental health services or getting mental health services is in any way affects the physician recruitment we do in the county, or affects our ability to attract professionals and retain them in the area?
I'm not sure if anyone knows about this level of inequity. Like, I've been coming, I think no one told me about it. I think I was coming in as an outsider and started to look into it because it just didn't make any sense to me. So I started talking about it everywhere I can. So I don't know that physicians would know about that, or if it would affect recruitment. I do know that we, as part of our Ontario Health team, are looking at integrating mental health and addictions into primary care settings, and that seems to be a very important way forward for the mental health delivery. I think it's going to be a difficult one. I think that no one really believed how much I kept screaming from the rooftop, like, how are we doing this? at the meetings, like, we don't have the resources to. We're already across 9 locations and have only so many frontline staff. We're there in the hospitals. We're there in the police detachments. We're there across 3 office sites. I don't know how we're going to be in more places, but with the right amount of funding, I think working together with physicians is going to be the way that we need to move forward.
Councillor McKenna.
Thank you very much, Rebecca. I just want a couple of questions, if I may, Madam Chair. I want to make sure we're comparing apples to apples in the funding. Would the Leeds-Grenville budget include the inpatient services? Because I believe those services are also under the budget of the Leeds-Grenville mental health service.
So this is, sorry, Councillor McKenna, this is only community mental health dollars.
Okay, and I do understand it was at least 4 agencies merged to create that budget. And Lanark County was part of that discussion, and for whatever reason at the time chose not to. So that money was intended to be pooled to serve all of Lanark, Leeds-Grenville. So Lanark made decisions well before your time to keep the program distinct. And I don't know if that had any bearing, but there were opportunities a decade ago or less, perhaps, that may have mitigated the impact of this. So I'm not saying it excuses anything, and I would like to look deeper into those numbers to ensure that we are comparing apples to apples. And my second question is the numbers of service numbers you quoted during the pandemic, the increase. Did they include the numbers from the mobile crisis response team?
The numbers of clients that we're serving?
Yeah, you noted, I think it was over 1,000 people in the past year. And
so we served, I think, 4,000.
4,000, right?
4,000 something, 4,200, and that's like over 4,200. Yes, it did include the mobile crisis.
Okay, so there were resources that came with that.
Yes, there were resources that came with that. We received funding through ConnectWell from Champlain Lynn because they couldn't fund us directly. So yes, there were resources for 2 mental health, 2.1 FTEs.
Right, thank you.
Councillor Alford.
Yeah, thank you, Madam Chair. If as Councillor McKenna says, he wants to dig into the numbers a wee bit, but it is somewhat shocking in terms of equity between, and I agree with the mayor that if we should approach the delegation process through AMO, but I also think, if I understood correctly, Rebecca, this is your first visit on what will turn out probably to visit the other lower tiers and the county itself. But I also think this council could entertain a resolution that could be circulated to all of our partners in the county as well. Because if, as you say, this inequity is historical nearly, but it's gotten much worse. It's pointed out all of the the worst parts of not being funded equitably to serving the people that need us most. So I would suggest that we take whatever concrete steps we can as a council immediately following this meeting, because I, like my colleagues, it's disturbing and it's not going to be better for a little while. I understand what you say, that the full effect of the pandemic has not hit everyone yet.
Councillor Brennan?
Yeah, thanks, Rebecca. And I was going to say the same thing. Maybe a resolution's in order here. It's unfortunate that we don't have presently someone at Queen's Park that's going to take this in hand. Hopefully we will soon. I have every confidence we will. But yeah, I think a resolution is in order for sure, because there is inequity, and we need to help our people. So I echo that.
Mayor Panko?
Yeah, Rebecca, is it sort of fair to say that, I mean, this long-standing inequity has had a long-standing detrimental effect on the communities in Leonard County? And when you think of probably an increased cost in policing, because we have to respond when people are in crisis, because they're not getting the access to the resources they need. Maybe the pressure on our emergency departments, people coming in crisis because they're not maybe getting the support that they need elsewhere. Of course, in combination with people's inability to fully get the best out of life because of also low income's not growing, and maybe as much in Leonard County because they can't fully participate it, because they can't get the resources that they need. So I mean, the spillover effect by a small lack of funding probably is a much broader cost to society and to the county and to the town because of what's happened in the past. Is that fair to say?
I would suggest so, yes. Mayor Panko, I also, if it's okay, would want to mention that I think it would be a good idea to look into those numbers. I sent them back to our LINs and asked if these were indeed correct, because I thought we had to have them wrong. We didn't include community health center funding because we couldn't really figure out how that, and there are some services for mental health and community in our community agencies or in our community health service sector. But in terms of these numbers for community mental health funding, they came right off the CAPS that was online with the Southeast LINs online. And when I sent them back, the first response was, oh, you've got the wrong population here. You should send us the population for Smiths Falls and Perth. I said, well, we're funded for all of Leonard County, including Carleton Place and Almont, and I thought at the time, I said to them, we're at about 72,000, and I think that's a conservative estimate in 2021, which isn't so far off from Leeds and Grenville. And I do think I think that some of what Councillor McKenna mentioned about there being an opportunity to join Leeds and Grenville as an agency is absolutely correct. I know that we resisted that and did not feel at the time that it was going to create equity for the county. And we're concerned at the time that we wanted to make sure Lanark County continued to have a main office or a primary site in its own, in the county. So there is a history to this that Councillor McKenna is absolutely correct. I should quickly mention as well that I was told, and I'm new, so this is all, secondhand, but the other regions in the Southeast, KFLA, HPE, and Leeds and Grenville, all came together. They looked at equity, they redistributed finances. Lanark County may have not been involved in that because there was an intention of Lanark County eventually merging together with Leeds and Grenville.
Rebecca, is there a method of determining the number of people per capita in an area who are having challenges with their mental health based on emergency room visits, based on information that through your own agencies and other agencies? Like I guess my fear is that not only do we get much lower funding than elsewhere, but we actually have more people who need support than on a per capita basis than elsewhere.
intergenerational trauma, more addictions, perhaps in Smiths Falls as well, increasingly so. I would suggest that in some areas, absolutely the case. I don't know if there is a way for us to do that here. We certainly do have ED visits, for example, but people aren't always finding their way there. I think it would be important to look overall at different communities, rural communities versus urban. I don't know though that we'd really get that that clear of a view, unfortunately.
Yeah, but again, we're willing to help any way we can.
I don't see any other questions, but Rebecca, I think the mayor ended in a perfect way. You can understand from the comments that my colleagues made that you have our full support as you move forward. And I thank the mayor for bringing you here tonight and bringing us up to the awareness that we have now. It is disturbing and it's not going to go away without, a lot of concern. And if a resolution is something that we think might help us, that perhaps is something we should be bringing back to another meeting. But thank you so much for your information and coming tonight. We appreciate it very much.
Thank you all very much for having me.
Okay, I need a motion for the adoption of minutes. Councillor McGuire, seconded by Councillor Brennan. The motion is that the minutes of the June 7th, 2021 and June 14th, 2021 Committee of the Whole meetings be received and filed. All in favor? Carried. Thank you. There is only one report tonight, and that is with our clerk, Nadine Bennett, and she is going to give us the emergency control update. So welcome, Nadine.
Good evening. Just a quick update that the Emergency Control Group met on June 30th. That was their last meeting. And at the time, the CMC, Chief Cheeseborough, provided the numbers of cases in Leonard, Cleves, and Grenville. I just checked before our meeting tonight, and there are 2 active cases listed on Leonard, Cleves, and Grenville website, 1 in the hospital, and that was updated July 12th today. So that has increased since our meeting. The group met, and at the meeting we had Kim McCann from the health unit, and she reported that the region is doing very well. Vaccination rates have been tremendous, and I think that everyone agrees that that the vaccination process at the arena is seamless, and that was discussed at how well it is operating. Director Manhire is looking at the vaccination clinic and services at the arena, and we'll work together with the health unit if that, if there's a need to move it upstairs or something so that the ice can be returned. But that is something that Director Manhire is working at. Public amenities were discussed, and there has been discussion about cooling centers, and CMC Chief Cheeseborough has reached out to the County of Lanark to see if they have any options with respect to cooling centers. They discussed, plans for activities at the Heritage House Museum and the reopening at the time of the library. They also discussed basically everything that was happening under stage 2, but as we know, it was just recently announced that step 3 will now be commencing on July 16th. So that's something that staff are moving forward with. We did have our staff at the town hall return on July 5th, and that is going very well. We are looking to reopen the town hall on July 19th, and there will be a formal press release sent out tomorrow with further details about that. So that's basically the update from the Emergency Control Group at this time, and we'll be meeting again regularly. Thank you.
Councillor Alford, do you have a question? Comment?
I do. As we are moving into phase 3, this was an emergency that we had not seen before. And I wonder what the process is for debriefing the last 16 months with regard to our emergency planning. Because certainly we've been well informed by our EMCG, but I think there are things that we hadn't encountered before, and there could be some very valuable lessons in case such a thing should ever happen to us again, and particularly when this emergency was so different in that it was a stay-at-home order. So I don't know what the process is, and I'm sure there's some kind of debrief that is being planned. I'm looking at the CAO because I think he chairs that committee, but I don't know what the process is or the timing is for that.
Malcolm's I can report as well.
CAO Morris.
Yeah, thank you, Madam Chair. So great question. And our plan was to do kind of a summary of what worked and what didn't work after the state of emergency is lifted. So council will recall that the state of emergency is still in place. And so the next step will be, and that's on our agenda, I believe, for this week, is to talk about the most appropriate time for the mayor to lift the state of emergency. That would then open the door for the kind of the recovery phase and taking stock of how we did and ways to improve it. So to answer your question, it's been discussed, it's in the queue, and I would expect something in the third quarter of this year.
One last question, Madam Chair, if you don't mind, and I'm not sure who to direct that to, but I hope part of the process is canvassing members of council for their thoughts, and because we all fielded a number of crises or things that hadn't come up before in previous emergencies. So I hope that's part of the process.
Certainly will be, yeah. And that report does actually, under Emergency Management Ontario, we do have to deliver that report to council as part of the process. So certainly council will be involved, and their input will be provided as well and included in the report.
Thanks, Nadine.
No
Thank
problem.
you for the update. There are no correspondence items this evening, and I do need a motion to move in camera, and we will just have one item, so we won't be too long. Councillor McKenna, seconded by Councillor Alfred. Thank you. All in favor? The motion is that Council of the Corporation of the Town of Smiths Falls, as provided in Section 239, Part 2C of the Municipal Act 2001, as amended, move into a closed meeting at 5:45 p.m. to discuss a potential disposition of land. And so we'll wait, and he will let us know when. Thank you for your patience. We had only one in-camera this evening, and the rising report for our in-camera was we discussed a potential disposition of land. So again, thank you for your patience. There's only one priority issue this evening, and that is 8.1 award of George Street Design Report. And Vanessa Bernanke is going to do that with us. Welcome, Vanessa.
Thank you. Good evening, Madam Chair and Council. I will be presenting Report 2021-74, Award of RFP George Street Detailed Design. The purpose of this report is to provide background on the request for proposal issued for selection of the preferred consultant for the George Street Detailed Design and to award the contract to the qualifying firm with the best overall proposal. Some background. In February of 2021, Town Council approved the 2021 budget, which included monies for the advancement of the detailed design work for the future reconstruction of George Street from Strathcona to Gladstone Avenue. In 2010, the town completed a drainage assessment upstream of the stormwater outfall and sought out ministry approvals for the construction of 2 oil grit separation units to support sewer separation efforts in the Maple Avenue and George Street catchments. And ECA approvals were later issued in 2016, and in 2019, the town completed the construction of an oil grit separation unit on the major outfall serving Strathcona and this project area. Currently, George Street stormwater catchment area is approximately 8 hectares and generates significant surface runoff that presently is captured by the combined sewer system and is directed to the wastewater treatment plant. The recommendation in this report will advance detailed designs and MOE approvals for newly separated stormwater system. The assignment will address water main design, sanitary and storm sewers, a geotechnical program, a roadway design, tree protection, replacement, enhancement, utilities, a servicing report, drawings, and public consultation. The terms within this request for proposal also stipulated that an ECA application be submitted by December 31st, 2021, and that all tender design documents be completed by May 31st, 2022. On June 3rd, the request for proposal closed with 5 proposals received. All of the proposals were individually reviewed, and the submissions from Greer Galloway Group and GHD yielded the highest overall score in the group and offered the best overall value to the corporation. The GHD and Greer Galloway proposals ranked the same. However, Greer Galloway has the lowest bid price. Greer Galloway also has intimate knowledge of this assignment as they completed the successful ECA in 2010 and the construction drawings for the drainage assessment for the commencement of sewer separation for the northeast section of the town. Budget funding sources. And so in February, Council approved a budget of $88,700 for the work. Greer Galloway Group's proposal net HST is $75,876.33, providing a projected surplus of $12,823.67. Staff therefore recommends that the town proceed with the award of this RFP to Greer Galloway Group. Thank you.
Comments or questions? Councillor Alfred?
Yeah, I support staff's recommendation. This is needed work underground, but if the work, the design is done and ready for tender, it gives us opportunities for funding from the province that we don't have to wait on. We can apply and hopefully be successful for. So yes, I support staff's recommendation.
Thank you.
Mayor Penko?
Yeah, I support it as well. And I think this report is a great example of why we do things strategically. And of course, we know that George Street, the roadbed is pretty rough. But there's no point replacing and fixing the roadbed until we do all the underground work as well. So I commend staff on the work they've done to bring this to this point. And we think our asset management plan guides our decision making. And when this is completed, it will enable us to have further sewer separation on this end of town and all the benefits of doing that. So it's just great work, Vanessa. I support the recommendation. We look forward to hopefully get this work done in the next couple of years.
Thank you.
Yeah, you've got all our support, but I have a couple questions if you don't mind.
Sure.
One is, in the roadway design that you have in your report, you talk about that now levels of service for sidewalks under discussion will likely have only one side done. I didn't realize when we were doing that it meant all of our older sections as well of the town.
That's correct. It's optimization of our maintenance program.
Right.
So,
I
so
understand
being
the concept, but it's a busy street. It's used by many seniors and walkers.
well, what we can do is we can do some visual assessments and check for requirements if there is over 100 pedestrians within an hour in an area. There's criteria for sidewalks, and as to through the public consultation, concerns can also be brought forward.
Okay, the other question I mean, a few years ago, one of the workers took us to, and Sean and Jay may remember this, took us over to one of their buildings to show us some of this underground piping, what you're replacing. So, I mean, yeah, we need to do this. But I guess my last question is, are all of the neighborhoods in where you're working now in Georgia, that whole neighborhood needs to be done? Would that be your thought?
Potentially, yes.
Yeah.
And basically going through the asset management, condition ratings and confirmation of priorities, then yes, ultimately through the years, things will have to be replaced.
Okay. All right. Well, thank you. You have your direction.
Thank you very much.
Thank you.
Have a good night. Thank you, Council.
Thank you. So I need a motion to adjourn. This is a very quick meeting. Councillor Alford, seconded by Councillor Brennan. All in favor? The committee adjourned its proceedings at 6:05 and stands so adjourned until the next duly called committee meeting, sorry, not